one of the problems unique to SUD, when you think about SUD treatment, there are specialty SUD providers, and then there are like community behavioral health providers that also do SUD as part of their treatment repertoire. But in both cases, what we see is a training deficiency, particularly around doing group therapy, well, I should say. They do a lot of groups, but the data is pretty clear that a good portion, in a lot of organizations, a good portion of that group therapy stuff that's being done is psychoeducational in nature. And if that's your primary delivery system, the data shows that psychoed is probably pretty much ineffective in terms of affecting change for people who have a substance use disorder. As a part of a broader program, certainly psychoed has its place, but not by itself. But the problem is when you try, we don't get, as a psychologist, I'll bet you 10% of my training in grad school was in groups. The other 90% was in individual therapy. So clinicians across the board, unless they really work at it, they don't get enough training in group therapy, which is unfortunate because the data shows that it's pretty much clinically equivalent to individual therapy for most problems.